On behalf of the Becca Schmill Foundation, I want to welcome you to Social Media and Our Youth, a virtual mental health forum. This event was made possible through the hard work of our volunteers and the financial support of Eastern Bank Foundation and Needham Bank, as well as the generosity of Copley Motor Cars, Dedham Savings, and Roach Brothers. My name is Deb Schmill, and I'm the president of the Becca Schmill Foundation. The foundation was started after the loss of my 18-year-old daughter, Becca, to fentanyl poisoning. She and a friend purchased the tainted drugs using a social media platform. Becca had previously been the victim of several traumatizing incidents that also involved social media. Since Becca's death, I have met dozens of other parents whose children experienced similar harms, none of which would have been possible a few decades ago. Our family has chosen to honor Becca's memory by working to prevent others from experiencing the anguish of similar tragedies. For this reason, the Becca Schmill Foundation has brought together two exceptional panels of speakers today. They're here to discuss the relationship between social media, tech overuse, and youth mental health. The presenters will discuss the evidence linking increased screen use to higher rates of adolescent depression, anxiety, eating disorders, and suicide, as well as addictive behavior, changes in social connectedness, and the loss of the ability to focus. They will also talk about what can be done to reverse these trends. Interest in this webinar reached beyond our registration capacity of 500, which speaks to the relevance of the topic, and I believe the sense of urgency for action. Thankfully, the Needham Channel is live streaming this program, and the recording of the webinar will also be posted on our website, beccaschmillfoundation.org, and emailed to attendees for future viewing and sharing. Questions for panelists can be added to the Q&A at any time. And note that the chat and hands raised features have been disabled. English subtitles are available by clicking on the live transcript closed captioned CC icon on the lower right side of your screen. Now I would like to introduce the co-host for today's event. Representative Denise Garlick has been advocating for children's mental health issues through her entire career as a nurse, a volunteer, a Needham Select Board member, and for the past 11 years as a Massachusetts state representative. Among her many accomplishments, in 2006, Denise founded and chaired the Needham Coalition for Suicide Prevention, which continues its work today and serves as a model for communities all over the United States. I am thankful that she is my representative, honored to call her my friend, and pleased to introduce Massachusetts State Representative Denise Garlick.
Denise, you're muted.
There. So Deb, thank you for that lovely introduction. I am deeply honored for the opportunity to participate in today's program and to learn with all of you. And I would like to just take a few brief moments for gratitude, for appreciation, and for reflection. First, sincere gratitude to Deb and Stu Schmill, and to the Shapiro, Leifer, Mann, Johnson, and Kaplan families. In your unimaginable grief, your compassion for all adolescents and all who love them has moved your energy to activism, and the foundation is demonstrating a profound commitment to preventing others from suffering. Secondly, it is with great respect and appreciation that I acknowledge the many participants today As you all heard, we have reached capacity for the number of people who want to participate in this format. I'm glad Deb and the foundation has found other ways for people to share this day with us. We all know it's a lovely day outside, but we are gathered inside today to find light, to find hope, and to find healing. The large number of registrants in this program reflects the great concern and that is prevalent as we witness the impact of social media on so many individuals of all ages, and particularly on adolescents. We acknowledge that social media is a tool that can strengthen personal networks and provide opportunities for information. But today we are acknowledging that it is also a weapon that can cause harm. So with that thought, it is a moment of reflection for all of us that we begin to listen to our very distinguished panels. The information today may help us in all the ways we can address these issues, certainly through family discussion, through community awareness, through policies and regulations and research, some of which can be addressed through budget and policy at a state level, and certainly as we're going to hear from one of our moderators at the federal level as well. We can do this through budget and policy making, including, I would like you to know, an anticipated omnibus mental health bill that I expect in this session of the Massachusetts legislature, which will be before July 31st. And it will address people of all ages, and the tremendous influx of budget influxes we have seen. The Massachusetts House of Representatives has voted this week the most robust budget for mental health that the Massachusetts has ever seen. And on a personal level, I want you to know, in my preparation for this seminar and in being able to speak to some of the participants, I know that I have a lot to learn as well in ways that I can personally model appropriate behaviors for my very cherished children and grandchildren, and helping them to deal with the impacts of social media. I am grateful for this opportunity. I look forward to our day. It is at this time that I have the opportunity to introduce to you the opportunity to introduce to you Jean. Jean, forgive me. I have so many notes here on you that I was struggling for my notes. It is my pleasure to introduce to you Jean Rogers to moderate our first panel. Jean is the parent of 5 children and has navigated a career, fascinating career, which informs her deep understanding of social media messaging and its power and its impact. Jean has a master's in education and is the renowned director of the, quote, Children's Screen Time Action Network. She is also the author of, quote, Kids Under Fire, 7 Simple Steps to Combat the Media Attack on Your Child. Jean hosts a webinar series, Action Network Live, and is a contributor to a newsletter called News You Can Use, because she believes in the power of we as we address the truly massive issue of social media. Thank you, Jean, for your work, your leadership, and for being with us today.
Thank you so much, Representative Garlick. I'm honored to be here today with the Becca Schmill Foundation to support this cause so critical to the future of our youth and our society. We know that the marketing industry coined the term tween to force children to grow up faster and become consumers at an early age. And we also know that the mental health issues we'll be discussing today are not limited to teens and young adults, but are starting earlier than ever. Many of us here today are parents, and what we know intuitively is that teens and young adults are still our precious children. So without further ado, I'll lead us into our first panel, where you'll hear from Dr. Clifford Sussman, Dr. Bryn Austin, and Dr. Richard Freed. My hope for you, our audience today, is that our experts might shock you with their observations, arm you with knowledge, and inspire you to take action. So our first speaker is Dr. Clifford Sussman. Cliff is internationally known as a pioneer in treating internet and video game addiction. He's been in private practice in psychiatry for children, adolescents, and young adults in Washington, D.C. since 2008 and is an expert consultant for the digital use disorder track at Karen Renaissance in Boca Raton, Florida. He's been featured as an authority on screen use issues in the media and peer-reviewed literature, and he's presented on the topic to audiences of all types and sizes at conferences, hospitals, schools, and other local and international and online venues. When I asked him why he was eager to join us today, he mentioned that he sees families struggling more than ever with screen use in these late stages of the pandemic, almost like a secondary pandemic. Today is an opportunity to help more families than his usual one-on-one work with them. Welcome, Cliff, and please get us started.
Thank you so much. Thanks for including me in this. So the only thing I'll add to that is that you can find out a lot more about my background and more on this topic as well at my website, cliffordsussmanmd.com. So I hope that'll be a resource you can all use after today. And I'll also add that I'm a gamer myself, and I'm a programmer. And in fact, I used to develop educational software and games before I went to medical school for kids. And so for me, it's really important to balance the use of digital technology in my life with activities in the real world. And this is what I help so many families and so many teenagers who are struggling with trying to find this healthy balance. And so while a lot of my patients really are primarily addicted to video games, or at least that's what they're struggling with the overuse of, really, there's not much difference anymore between video games and social media. In fact, the types of games that my patients struggle with the most really are a form of social media. The big thing in gaming for a while now has been multiplayer games, massive multiplayer online games. This is the type of games that kids struggle with the most by far. Here you can see gamers dressed as the characters they like to play in Fortnite, which is one of the popular massive multiplayer online games. And all these games have built-in social media. They have ways for gamers to talk with each other on a headset. They have ways for gamers to talk with each other by typing text messages to each other during the game. And if that's not enough, you can also communicate outside the game using a very popular app, or one of several apps, but a very popular one is called Discord, which is kind of like Facebook for gamers. So, and I know a lot of parents are familiar with this. So Discord is where gamers are talking to each other all over the world. And they're also talking to their local friends, and they're finding out, which games their friends are playing so that they can go and join them. But you can use it for any of the social media purposes that you might use any social media app for as well. Although I find that when my patients are on Discord, they're usually socializing about video games. That's what they're talking about. They're not usually talking about too many real life types of issues. So here you see a screenshot from a typical massive multiplayer online game. This one's called Mario Kart. And again, you can play with your local friends and you can play with players around the world. But they had versions of games like this when I was young, where the definition of multiplayer gaming meant you were playing with the two people sitting next to you holding a controller. So things have really changed. And one of the things that games provide, that social media, all forms of social media provide, is an escape from reality and an escape from the stressors of everyday life. And sometimes a shortcut to deal with the stressful tasks of everyday life. A good example of that is dating applications. This is a big thing that teenagers and young adults are doing online. And, the great thing for teenagers about using online dating or using any types of online social media to meet other people is that you don't have to be yourself. You can put forth the best version of yourself. You can look up how to look thinner or older or younger or taller. You can cherry pick the best pictures of you that were ever taken. And that's what people are going to find out about you. So it really becomes almost a social aid. And it kind of, for many people who may have insecurities or may have inadequacies, it levels the social playing field. You can even socialize as an avatar. This is a game called, I don't know if you call it a game or social media, again, showing how blurred the line has become between the two. But this is Second Life, where you can be an avatar and walk around a virtual world and talk with other avatars and do the same things you do in the real world or different things. And you can have an avatar that's exactly like you or an avatar that's someone else completely. So you can really live in the virtual world the way you might like to live in the real world. Or you can live a complete fantasy life and escape reality altogether. So these are some of the things that keep teenagers on social media. Now, I actually work with a lot of kids in the spectrum, a lot of high-functioning autistic kids, and they tend to have some of the worst video game compulsions. For kids in the spectrum, social media really levels the playing field because, for one thing, it's very difficult for them sometimes to understand other people's facial expressions or read their nonverbal cues in real life. And it would be a lot easier for someone in the spectrum to, be text chatting with someone and understand how someone else is feeling by looking at the emojis they're putting forward than to look at their actual face and try and read into their feelings. The feelings are much clearer on an emoji. So, sometimes it's really a struggle for the parents I work with of these autistic kids because, they're afraid that if they pull them off of social media, that they're going to lose all the social contact they have, where they may not be talking to anyone in the real world anymore. Other things you've heard about, I'm sure, or you've dealt with, if you're parents out there, fear of missing out. So it can actually be, fear and anxiety that gets us to go online. Which is interesting because it's also social anxiety that can get us to go to social media, again, as sort of an escape from having to deal with, some of the social pressures of real life interactions. So there's fear of missing out that keeps us on our screens. And there's also, so that's FOMO, right? And then there's also NOMO, which is where a fear of leaving home without our cell phone, a fear of being somewhere and not having our cell phone handy. So it's like we almost develop a real attachment to these devices. They come like a security blanket to us. So I want to talk a little bit about addiction, since that's really what I'm brought in to discuss today. So, aside from all the qualities of social media I just mentioned, social media has a quality that really is essential to anything being able to become habit forming. In fact, without this quality, you simply can't get addicted to something. And that quality is being immediately gratified. In other words, addiction is predicted by not how intense a feeling you get from something or how high it makes you, it's not defined by the quality of the feeling it gives you. It's really what makes you more addicted to something is how fast you get the feeling you want. So immediate gratification is essential to anything being addictive. If you have to wait a long time for something and be patient, you're not going to get addicted to it. So as social media gets more accessible, as we're able to have less of a delay between when we want to get on Instagram and when we pull out our cell phone and get on Instagram, the shorter that delay is, the more habit forming it is. And what social media does for us, as well as other digital media, is that it provides us instant and continuous gratification. Now, you may have heard of dopamine. That's the pleasure neurotransmitter in the brain. It gets released not when we're getting any kind of pleasure. It gets released when we're getting what we want, when we want it, with the emphasis being on the when we want it. Again, the dopamine system in the brain is very primitive, and it really just cares about how fast you're getting something. So that's one key to addiction. Another key to addiction is a concept called variable ratio reinforcement. So for something to really grab us on social media, there has to be a maybe factor. And that let me explain what I mean by that. So when you go to a casino and you see gamblers pulling on a lever at a slot machine, they don't know which lever pull is going to get them a prize. They don't know which lever pull is going to get them nothing, right? And the fact that it's random and unpredictable, the fact that there's the maybe I'll win this time factor is what makes playing a slot machine so addictive. And Vegas knows this, and people who design games and social media know this, right? And it's actually more addictive, more habit forming to scroll down on, let's say, Facebook or Instagram or Snapchat, to scroll down through lots of different posts if they're not all ones that you like or that are interesting to you. In fact, it's more habit forming if it's random, and that some of them you may not care about and some really grab you, because that provides variable ratio reinforcement, that unpredictability factor. So that actually gets us more hooked on our devices. And when you think about it, it's like, it's almost advantageous for a lot of social media to provide us with not all high quality content. So this is what the pathways in the brain that involve dopamine, this is where they're located, and these are the ones that are lighting up when we're getting this continuous gratification of our devices. And what happens is when we're getting this for a long time, when we get all this dopamine rushing through our brains, we become desensitized to it. We develop a tolerance to it. And something that's really stimulating to us becomes less and less stimulating over time. But the problem is everything else that's not on our device also becomes less stimulating, because we're desensitized to all dopamine, not just dopamine from games. And so, pretty much after a while, if you're binging on this all day long, you really need to get back on social media so that you can get your next dopamine hit. And a lot of what you see is people will go from one form of dopamine to another. For example, if a kid is on their computer playing a video game and maybe the mom finally gets them off, maybe a few moments later, they're in their bed, picking up their iPhone, watching people playing the games they were just playing or scrolling through social media. So they basically replace one form of dopamine with another. It's kind of like when you see people standing outside an AA meeting, smoking cigarettes or looking at their cell phone for that matter. Now, just like I was explaining that digital media like games have gone social, I would say that you could argue that all forms of socializing are starting to go digital, as evidenced by the multiple platforms, the multiple apps, even porn and information like Wikipedia can be accessed now all digitally. Shopping is digital, even gambling is digital. And we're really in a digital environment. And in a digital environment, we're surrounded by cues everywhere that remind us to take out our device. It's like when an alcoholic walks into a bar and they see everybody drinking and they see the sights and sounds and smells and the lines of bottles. It gives a cue to their brain that says, hey, it's time to drink. And their brain starts to release dopamine before they've even had a drink. And this is perhaps what's happening to us when we're sitting on a subway and we see everybody there with their cell phone out, or when we're sitting at the dinner table. it sends a cue to us that it's time to take out our device. COVID-19 provided people with so many rabbit holes to go down on social media. In a way, I think it strengthened that attachment. Not to mention that people had to do so much socializing digitally because they were forced to from the lockdowns. Let me just wrap this up by telling you what the technical definition of addiction is, so that if your kid is really having a problem, what are the signs to go and ask for help, at least in terms of having a problem with excessive screen use. So the World Health Organization, unfortunately, doesn't yet recognize social media disorder or social media addiction. They do, however, now officially recognize gaming disorder. It's going to be in the next International Classification of Diseases, the ICD. The ICD-11 will have this in it. Right now, they're still using the ICD-10. Now, don't be confused by calling it disorder instead of addiction, because they do the same thing with alcohol and cocaine and all other drugs. They say alcohol disorder, cocaine disorder, but they're really talking about addiction. And addiction is defined by when you have to, when you're having negative consequences in your life. See, continuation or escalation of gaming despite the occurrence of negative consequences. So addiction is defined by the severity of the negative consequences caused by us doing something we can't stop doing. So it's not defined by how much we're on social media or games. It's defined by the problems that being on social media games is causing in our life, despite our inability to stop doing them. And so really, if you want to know if your child's having a problem, look at how they're functioning. Is it causing problems with their socializing, with their academics, with their grades? Are they having psychological problems? Are they having medical problems? That's really the key to defining addiction. And so with that, I want to leave a lot of time for our panels and answering questions. So I'm going to wrap up there. And I thank you for your attention. And please remember to go to my website for more information, cliffordsussmanmd.com. Thank you.
Thank you so much, Cliff. What's clear to me when I hear your expertise is that the issue of addiction is much more complex than we have ever understood in the past, especially with regards to screens. And so I just want to remind everyone who's with us today that if you have questions for Dr. Sussman or any of our panelists, you can type them into the Q&A box below. And now I'd like to introduce our second speaker, Dr. Bryn Austin. Dr. Austin is an award-winning researcher, teacher, and mentor at the Harvard Chan School of Public Health and Boston Children's Hospital. She directs the Strategic Training Initiative of the Preventing of Eating Disorders, a public health incubator, and is past president of the Academy for Eating Disorders and the Eating Disorders Coalition. She's a social epidemiologist and behavioral scientist with a research focus on health inequities, especially those affecting socially and structurally marginalized adolescents. And she's received numerous grants funded by the National Institutes of Health and foundations that support her research. Bryn has been passionate about science and social justice from a young age, and after working in journalism and HIV/AIDS activism at the beginning of her career, she found a calling to public health where she could bring it all together. She joins us today from Roslindale neighborhood in Boston, where she lives with her wife and her cat, Olivia. Welcome, Bryn.
Thank you very much for that introduction. I'll just share my slides. Thank you. And I enjoyed Clifford's talk, learned a lot about addiction. I'm going to be talking now about social media. I'm going to bring in eating disorders and then all together with teen mental health. I want to begin by saying I have no disclosures. I received no funding from the industry, have not signed any NDAs with the industry. So much work was being done before last fall, but we all know that when the Facebook files were broken by Wall Street Journal and their investigative series based on the work of Frances Hogan, the Facebook whistleblower, that's when we got the country to give laser focused attention to this issue, and particularly around teen mental health. And thankfully, Frances Hogan also brought into that eating disorders and body image, which I'm going to come to momentarily. There was a lot of coverage at the time of the hearings with Frances Hogan to this topic. And I want to share with you the words, just one piece that was published last October by a father, Ian Russell, who some of you know, some of you work with, writing in the Washington Post an opinion piece where he wrote about his daughter, Molly, in a piece where he explained that how powerful Hogan's testimony was in the files that she released there. What he called for in his op-ed was for Facebook to stop monetizing misery. As the father, Ian Russell, wrote, Hogan explained in her testimony before the U.S. Senate how Facebook's algorithms use engagement-based rankings to tailor content to each user, often showing them more and more extreme content based on what they engage with. And he goes on to write about his daughter. For Molly, this meant an Instagram feed full of suicidal ideation and self-harm. These are powerful words from Mr. Russell, and there are words I want to get back to in a little bit. I'm going to take it now to eating disorders, which is what I was asked to talk about, eating disorders and body image, and then I'll bring it back to Mr. Russell's words and the topic more broadly of social media. So why eating disorders? Recently, my organization, Striped, based at the Harvard Chan School of Public Health and Boston Children's Hospital, issued a report in partnership with Deloitte Access Economics on the social and economic cost of eating disorders in the United States. The key takeaways on eating disorders are that they are common, they are deadly, and they are expensive. Nearly 30 million Americans alive today, or 9% of the population, will have an eating disorder at some point during their lives. Nearly 2 million children alive today will have an eating disorder before they are 20 years old. Eating disorders affect all ages, across the lifespan, all race ethnicity groups, although I want to flag that eating disorders among people of color are half as likely to be diagnosed or to be offered treatment compared to white peers. And this is because of bias of racism and barriers to care in our healthcare system. Eating disorders affect all genders, all sexual orientation groups, all body sizes. We estimated, based on this work, that over 10,000 deaths occur every year in the United States as the direct result of an eating disorder, which equates to one death every 52 minutes in this country. Eating disorders have among the highest case fatality rate of any mental health condition. And it's estimated that 20% of deaths due to anorexia nervosa are specifically due to suicide. The main take home on the economic analyses, eating disorders cost the US economy every year $65 billion. Every year, $65 billion as a direct result of an eating disorder. Now, all of these data I presented so far are from before the pandemic, but we know the pandemic has changed everything. The pandemic, within the early months, within a month, 2 months, the pandemic brought a perfect storm of fear, social isolation, disruption of normal routines and care access, and extreme stress and uncertainty with financial precarity. And all of these are linked to depressive symptoms, anxiety, suicidality, and eating disorders. This same perfect storm was linked with worsening restriction as dietary restriction, purging, binge eating, hyper-exercise. This was exacerbated by news media and social media hyper-focus on weight gain due to the disruptions of normal routines. This kind of intense fat shaming right from the start of the pandemic, the pressure to have dietary restriction, reduce weight, led to skyrocketing rates of eating disorders among young people. And the need for care now far outstrips our healthcare system's capacity. I'm going to show you a couple of slides from children's hospitals in the US here. What we've seen at children's hospitals is that during the pandemic, the eating disorders caseload has increased 2 to 3 times compared to pre-pandemic. So on this slide, you'll see data from Boston Children's Hospital. The vertical line there represents the pandemic onset. You see fairly constant, stable rates of eating disorder cases at Boston Children's Hospital. Once you get past that vertical line, we see a steep increase, 2 to 3 times higher rate of eating disorders caseload. You'll see the same figure from Michigan. This is a children's hospital in Ann Arbor, Michigan. Same pattern here with the onset of the pandemic. And we now know that children's hospitals all across the country have experienced the same thing. In this last slide, I'll show on these kinds of data. It's from the CDC, released just in February. The CDC released a report tracking emergency department visits and found that among teen girls in particular, they saw a doubling of the eating disorders caseload at emergency departments all across the country. Again, the vertical line, you'll see the big change in slope for the caseload for eating disorders. So we've seen a marked increase in eating disorders timed with the onset of the pandemic. Now, bringing it back to social media, with an increasingly digital world where a quarter of adolescents are on social media almost constantly, social media platforms are continually bombarding youth with highly visual content that's extremely engaging by design, often using the techniques that Clifford just described to you. Among 13 to 18-year-olds, nearly 2/3 use social media every day. And these are new data from this year. Although the federally set minimum permissible age is 13 to use social media, nearly 20% of children ages 8 to 12 use social media daily. Now, turning to some of the research around how young people are relating to this, there's a reciprocal relationship between depressed mood and engagement in adolescence, such that vulnerable youth are drawn in via the algorithm engagement practices that we learned a lot about with Frances Hogan's testimony and all of the hearings last fall. These engagement practices then will worsen the user mental health. A large longitudinal study that just came out from the UK very recently this spring with youth from adolescence to young adulthood found distinct developmental periods for heightened sensitivity with the negative effects of social media. So they found this period was between the ages of 11 and 13 for girls and between 14 and 15 for boys, which maps onto the maturational development stages for girls and boys being shifted by a couple of years. The higher media use predicted reduced life satisfaction a year later in these young people. We also know that high frequency and prolonged use of social media, particularly image-based social media, are linked with negative appearance comparison. And this in turn increases the risk for eating disorder symptoms. So with eating disorders and body image, we're especially worried about the image-based social media. That's Instagram, TikTok, and some others. Now, worse yet, engagement-tailored algorithms will feed extreme eating disorder user-generated content to vulnerable users. And then they place ads for mainstream youth brands between the extreme eating disorder content. So there's multiple ways that this damaging content gets fed to young people. Several really groundbreaking reports that came out in the last few months. In December, we saw 2 reports from the Tech Transparency Project, which is a watchdog, a community-based watchdog group. They published in early December, Instagram's algorithms fuel eating disorders, investigating just what about the algorithms are worsening eating disorders. And then also that same week, they produced another report on their investigative journalism, looking at how illegal substances are being targeted toward young people on Instagram. This was followed soon after by an investigative report from Wall Street Journal, where they were looking specifically at eating disorders, looking at TikTok this time instead of Instagram. So with TikTok, what the Wall Street Journal did was they created a dozen automated TikTok accounts, registered them as 13-year-olds. And then what they found was that within just a few weeks, the algorithm was serving tens of thousands of weight loss videos, including so-called tips on how to eat less than 300 calories in a day, how to consume only water, take laxatives. It depicted emaciated teen girls with protruding bones and literally something called the corpse bride diet. And then very recently, Fair Play, an organization I know many of you are familiar with, published a groundbreaking investigation, again on eating disorders, this time looking at what they call the pro-eating disorder bubble. So for this, what they're looking at is accounts where it's user-generated content that's pro-eating disorder, teaching people eating disorders tips, but it's not just produced by users and out there unmediated. That actually the platform is promoting the content. So that's what Fair Play is analyzing. Fair Play identified 90,000 unique accounts, which they refer to as the pro-eating disorder bubble on Instagram. And these are accounts where users are putting out really toxic content promoting eating disorders. But these accounts are promoted in a way on Instagram that they are reaching 20 million unique followers. Children as young as 9 follow this bubble, where the median age is very young, it's 19. 1/3 of the pro-eating disorder bubble includes users who are less than 18 years old. And then they, in turn, have 500,000 followers. And this is all engineered by how the Instagram algorithms are working. And they go on to examine the profits that Meta or Facebook is making from the pro-eating disorders bubble. So what they present in the report is that $2 million a year comes directly from the bubble in terms of advertising dollars, plus an additional $228 million from the followers of the pro-eating disorder bubble. Then additional costs is particularly focused on the minors, people younger than 18. $500,000 a year is from the 18-year-old accounts that's advertising attached to those accounts in the pro-eating disorder bubble, plus another $62 million a year from followers of these underage accounts or of the under 18 accounts. So I don't want to leave you with just the bad news about the relationship between these image-based social media, the algorithms that send people down rabbit holes. I want to offer some solutions too. So where do we go from here? I'm going to mention a few policy options that are getting a lot of traction now. First one, design needs to be age appropriate. With this, we can institute age-appropriate requirements like what's being done already in the UK. The UK has a child safety law that they put into effect last September, just last year, and it applies to all platforms operating in the UK that have any children users whatsoever. A few of the approaches they're using for age-appropriate design are to eliminate nudge techniques to get users to give up privacy, eliminate data collected on children, and give children privacy defaulted to the maximum. So with this, breaking news here in the US, currently in California, there's legislation, AB 2273, that's modeled on the UK law. If this is passed in California, it'll be a model for other states in our country. A second policy option, we need third-party risk audits, and they need to be independent. So ensuring that third-party auditing bodies have the appropriate expertise and independence will be critical. We can't task shift this to industry, and we need to prevent industry NDAs from being used to silence auditors. The auditing bodies need to have expertise in data science, of course, but also in mental health and child development, and they need to have diverse backgrounds. And that's where the industry has very much fallen below what we should expect, what we require to create safe spaces. In addition, we need institutionalized protections from political interference. And with this breaking news, I want to share is that New York City has already passed a law to mandate external auditing of automated employment decision tools. Now, this is a very specific use, but it's an incredible model here that we can be looking to. They've mandated that algorithms that are used for hiring, firing, or promotions need to be audited every year to ensure that they're not replicating racist or sexist or other kinds of biased employment practices that we know are currently being promoted through these kinds of algorithms, decision tools for employment. And the third policy option I want to hit on here is disclosure. We need to require disclosure of the algorithms, the tools, the processes, and the results of third-party audits. In addition to what we got through Frances Hogan with the whistleblower paper she revealed, but we need that to be regularly revealed with internal research that these platforms are doing on their effects on health, mental health, social behavior. The data need to be made available in a timely way to researchers, journalists, and NGOs. With this in the United States, we have a bill. It's not law, it's a bill, the Kids Online Safety Act in Congress now, sponsored by Senator Blumenthal and Senator Blackburn. It actually includes provisions that cover many of these points. And the bill is written in a way to also attend to the risk around eating disorders, body image, and mental health. So the breaking news here is that the EU is ahead of us. That's not a surprise so much, but in April, just a week ago, in the EU, the Digital Services Act was approved by all the member nations. What that means is that it'll soon be signed into law, and the DSA actually includes provisions covering all of these points I've made. It will prohibit ads targeting minors. It'll mandate third-party auditing, risk auditing, and disclosure of algorithmic practices and data sharing with researchers and NGOs. So I want to turn back to the father I mentioned, Ian Russell, and his words, why this work is so urgent to be happening now. As he wrote, quote, "Time is of the essence. Every week that companies such as Facebook are allowed to obstruct and obfuscate is another week that children like Molly will needlessly lose their lives." Thank you.
Thank you so much, Bryn. It's obvious that relentless persuasive design techniques are developmentally exploiting our precious youth. And thank you for highlighting our report from Fair Play and the legislation that is proposed and will give us hope. And again, if anyone has a question for Dr. Austin, please pop it into the Q&A box below. And now I'd like to introduce our third presenter, Dr. Richard Freed. Dr. Freed is the author of Wired Child, Reclaiming Childhood in the Digital Age. He's a child and adolescent psychologist and the leading authority on raising children in the digital age. He's a regular contributor to the Huffington Post, and his insights have been featured in the New York Times, The Atlantic, and other media platforms. And we are fortunate to have Richard on our advisory board at the Screen Time Action Network at Fair Play. He lives in Walnut Creek, California, and is the father of 2 teenage girls. And welcome, Richard. Take it away.
Thank you, Jean. And I want to say thank you to Deb and Stu Schmill for the Becca Schmill Foundation for having me here. And thank you to Drs. Austin and Dr. Sussman for their wonderful presentations, really talking about the risks of social media. And I'm going to be talking about today why kids are finding themselves on social media and why it's such a struggle to set appropriate limits. Let me just share my presentation. So really, I just want to talk about, we heard the real risk with respect to kids and social media, but what we don't hear is, I think there's something else that the public hears about why it's so important to put your kids onto social media. For example, Dr. Austin talked about Frances Haugen's really important work with respect to being a Facebook whistleblower, really talking about what Facebook knows within their company, but they're not disclosing. So those are real risks, but what does the public hear about why they're supposed to put their kids onto social media? This is a pretty typical news article from the San Jose Mercury right here in Silicon Valley, talking about this is right after Frances Haugen came out, right after the disclosure. What do we hear from a supposed child, health safety expert? We hear, yes, we do need to hear. I'm going to try to shut that down so I can see. We do need to take Frances Haugen criticisms of Facebook seriously, and the company does need to redouble its safety efforts. So perfect PR coming here, like, oh, we're going to take in the blow, but now we're going to come back to say, oh, but we really shouldn't do anything. But we also need to put this all in context and look at the bigger picture. Let's not all worry so much about it. There's these risk of unintended consequences. Essentially, let's do nothing. By Larry Magid, connect safely. Essentially, parents, don't worry about all this. We hear about connect safely, but who is this Larry Magid guy? Well, if we look down below, Larry Magid actually sits on Facebook's safety advisory board and is the CEO of Connect Safely, who gets all this money from Facebook and all these other consumer technology companies. So it's a really difficult message. This is what parents are hearing. And if we're wondering why parents are struggling, we might hear about these risks, but then we're like, oh, well, we're being told that the kids are actually supposed to be on there. So I think what parents try to do is say, like, well, I'll put my kid on there, but I'm going to set a few limits on it, and I'm going to really try to keep him, on track and not let it have them take over their real life. How does that work out for families? It's not working out whatsoever. Why is that? What parents don't know, and I'm in one of my main focus right now is that I study persuasive design, and persuasive design is all this hidden psychology that's behind kids' screens. I wrote the first major media piece on persuasive design back in 2018, talking about how social media companies use this very powerful behavioral science to pull kids onto their devices to not let them go. And this is so much, parents don't know what you're up against. Oh, I'm just going to have my kid be on social media. This is a program that's designed, or this is a powerful behavioral psychology that's designed to overwhelm kids' self-control, and I believe overwhelm parents' efforts to raise healthy kids. This is persuasive design was developed at Stanford by Dr. B.J. Fogg, and is it really designed to kind of affect kids? Yes. These are machines designed to change humans. We're purposely designing social media to influence, to motivate, to control kids. And how does this all work? It works by exploiting our vulnerabilities that we have from our Stone Age times, because we've grown up in a really different era. But it really exploits vulnerabilities, and especially kids. This is from Dr. B.J. Fogg. Again, this is from his website, talking about how social media is going to use social rejection and social acceptance for profit, how we're going to use that to pull kids on. And we know that preteens and teens are developmentally and neurologically hypersensitive to social rejection and social acceptance. So we're going to exploit that if we're a social media company, and really exploit, Richard? Yes. Why is that not advancing? So I can go. I don't know why. Huh. Hopefully I can advance. Oh, there we go. Dr. Fogg tells us, today with social technologies or social media a reality, the methods for motivating people or influencing or controlling them, people through social acceptance or social rejection, have blossomed. This is all used on purpose to pull kids onto these sites and to not let them go. So if you're wondering why, when you hand a smartphone off to your kid, at a certain age, and you're hoping you're going to maintain control of it, but you typically lose it, and you typically lose control of their social media use, this is a good reason why. Really, it's set up as a vicious cycle. As we saw from recent revelations, Instagram wants teen time spent. They want it to pull your kids and keep them on there for as much time as possible. So how are they going to use persuasive design, this hidden behavioral psychology, to do that? We're going to exploit that developmental vulnerabilities of social validation, and of this, but even more than social validation, an avoidance of social rejection, which the preteen and teen brain is just so sensitive to. We're going to quantify that with likes and followers. We're going to make a very public display of how much you are accepted or how much you are rejected. That would be the last thing that you would ever want to do to a preteen or teen girl. And then we're going to have psychologists. That's unethical. And I've written to the American Psychological Association. Jean, who introduced me, thank you, Jean, at Fair Play. Fair Play helped put together this letter that we sent to the American Psychological Association saying psychologists should not be involved within Silicon Valley industry, but they are, and all these other behavioral and brain scientists, and they are tweaking this stuff, and they are making sure your kids live on social media all the time, or as much as possible. And then what we actually find is social media actually, because it doesn't give kids what they need, we're going to see what they need in just a moment, but because it doesn't give them what they need, it actually increases their loneliness. What do they need to do? It drives their compulsive use. So they're going to go back to social media and try to feel less lonely, but then they come out feeling more lonely. It essentially is a product that creates its own demand. What does that? Cigarettes and other drugs. It's essentially acting like a drug. So what we are really losing kids. This is entertainment or consumer technologies as a whole. The last research is 8 hours and 39 minutes every single day. Social media is a big part of that, and it's increasing. Who's affected more? Higher income kids are spending way too much time, but lower income kids are really spending a lot of time. White kids, way too much time, but Black and Latino kids are just really, those kids that I work with in my practice. I really focus on two things that I'm halfway well known for right now, which is persuasive design and the disproportionate negative effects of all this screen time on less advantaged families and kids and kids of color. And I think we're really going to see, and we are starting to see it, but really serious negative effects with respect to things like child obesity in less advantaged populations. And they are really getting affected. And we sometimes don't really pay attention to that. When you see, you'll just hear the typical, oh, set limits and so forth. That's not working out for the families in my practice. So why is social media harmful to girls? Mostly there's, as Dr. Austin and Dr. Sussman talked about, there's a lot of negative content. There's social aggression. You know, they're in that political environment of who's in, who's out. That's really toxic for girls, that public display of how much they're being rejected. That's really painful. So that's content. But what we don't really pay attention to enough is dismissed. When kids are being pulled on to social media by that powerful science, they're being pulled away from their real world lives. They're being pulled away from the two most important elements of teens' lives. And we really, as a country, don't know what those are. When I go talk to groups of pediatricians and to mental health professionals, I will say, what are the two most important elements in teens' lives? These healthcare providers generally don't know. So I'd like to talk about that. If we're worried, because you're going to be hearing, oh, we can't pull kids away from social media because they need to be connecting with their peers, should be number one. Their online peers should be number one, and these strangers who they talk to should be number one in their lives. But really, what matters most to children and teens, and this includes, we're going to see a very diverse sample here. This is study number one. What protects kids from self-directed violence? What protects kids from cutting? We're going to throw it into a supercomputer. We're going to see, is it family? Is it peers? Is it school? What do we find out? A very diverse sample. Family connectedness is number one. If we want to protect, these are teens, right? 7th to 12th grade. If we want to protect teens from self-injury, we need to connect them with their family. That is imperative. The second most important element of protecting kids from all this self-injury and depression and so forth is their school connectedness. That means being connected at school with school educators and teachers and staff. They need to feel at home there. The theme here is going to be caring, loving adults. What about peers? What about, we've got to turn your kids loose to peers and strangers. In this study, peer connectedness showed possible greater risk. Like when kids get really connected with peers, wow, that might actually increase their chances of hurting themselves. Why would that be? We don't always see this, and the statistical significance was just a little bit under what would be positive. But why would we see that? I see it every day in my clinical practice. Kids leaving their parents behind and their families behind, living in back rooms, connecting with peers, and kids are not meant to be raising kids. 11, 12, 13, 15-year-olds are not meant to be raising one another. Eventually, social aggression kicks in. We're going to turn our back on you. And girls end up cutting and in the hospital because of that, when all their peers leave them behind. A second study. Really what I wanted to show is this is quite consistent across the literature. Again, what protects kids the most from being depressed? A very diverse sample. Youth who felt more connected to parents. These are actual quotes. Lower levels of depressive symptoms, suicidal ideation. Kids need their parents. Youth who were more connected to their school. This really helped. We've got to connect kids with school. Peer connectedness didn't really help or hurt. Wow. Is that where we're really supposed to be turning our kids, to social media? Study number 3, supporting transgender and gender diverse youth. We're oftentimes hearing, LGBTQ kids, they need lots of social media. What we don't hear is that when LGBTQ kids are at risk, high risk of cyberbullying. I think oftentimes about twice that of straight kids. And that leads to, is a big contributor to suicidal thoughts of suicide. And I believe is really driving the higher rates of suicidal ideation and cutting and potentially suicide in LGBTQ kids. But let's take a look at the study. Again, a very diverse sample, transgender US youth. Connectedness to parents helped. Connectedness to peers did not. They didn't look at school, but parents helped, peers did not. From depression and suicidal thoughts and so forth. What do they conclude with? This is a quote: transgender youth need broad, flexible support networks comprising caring and connected parents, teachers. You're going to hear from Matt Miles and Joe Clement in just a little bit about how important schools are and how giving kids smartphones in school pulls them away, and their remarkable book, Screen Schooled, how that pulls kids away from the teachers that would support them. Why in God's name are we doing that? And other adults in the community. Essentially, the key word here is and other adults. Kids are not meant to be, this whole idea that social media is like 15, 20 years old. The whole idea that kids are supposed to live amongst peers and a guy in his mom's basement or something, some stranger, that's where they're supposed to live at the expense of family and school is a big fat lie. So the real science of childhood and adolescence is family and school. Who knows that? The very top echelons of, they're the ones who set profound limits on their own kids' use of tech. They know all that. What do they have? What do these top tier tech elite families have that other people don't have? There was I think Kristen Stecker, a Silicon Valley parent. She kind of asked in a New York Times article, is it information or is it privilege? And the answer is it's both. These tech elite families have, they have lots of insider information and they have the access to quality screen alternatives. So how can we help all families? Firstly, we need to realize it is not a fair fight. This can't be, you're just kids protect themselves and parents, you do this. That is not working out. We saw the numbers for families, especially the less advantaged families, about how much time their kids are online. So what do we need to do? I am testifying on Tuesday for AB 2408. Dr. Austin talked about taking legal action. This is a California law saying that social media companies should not addict kids. Of course. So I'm testifying for that on Tuesday up at the California State Legislature. We need, what can healthcare and schools do? I believe the American Academy of Pediatrics and the American Psychological Association have really failed kids, essentially, not done enough. Where is the message that these tech execs parenting, where do they have it? Let's push back the age. They're pushing back the age when kids get phones. They're pushing back the age when kids get smartphones. When you send kids to fancy private schools, they're not letting kids be on smartphones, but at public schools they are. We need healthcare and schools to step up. Lastly, the last thing I really want to say here is all these tech, folks in Silicon Valley, they have access to quality screen alternatives. The families in my practice oftentimes do not. If we want to get kids off of screens, we need to talk with them about why that's important and everybody, and really disclose that and not lie in the public media. And we need to also invest in families here and provide them quality screen alternatives. Thank you.
Thanks so much, Dr. Freed. I wanted to just say that thank you for confirming that parents are not to blame, that these tech companies are making it much more difficult to parent today. And now I'm going to pass it back to Representative Garlick, who will lead us into our next panel.
So I wanted to thank you, Jean and Clifford, Bryn, and Richard. I want you to know on a very personal and professional level, I am overwhelmed by the information that we're receiving, how profound it is and how compelling it is. And as Deb had said, what a call to action. As we move to our next panel, I would like to introduce to you the moderator, Josh Golan. He is the parent of a 13-year-old, and he is one of our Massachusetts neighbors. He is the executive director of Fair Play, and we've heard that discussed a little bit today. That is the nation's leading independent watchdog of children's media and marketing industries. Fair Play is leading a quote, Designs with Kids in Mind, a campaign to demand regulation to protect children's online. And in addressing Congress, which Josh recently did, he stated that there is, in fact, he has experienced a bipartisan human response to what is at stake for all of our children. May we all hope it leads Josh, the Congress, and all of us to appropriate action. Josh?
Thank you so much, Representative Garlick, for the kind introduction. It is great to be here and to support the incredible work of the Becca Schmill Foundation. Our children are growing up, as we've been hearing, in an online environment that wasn't built for their benefit. Kids and teens are spending the majority of their waking hours on platforms that are deliberately designed to keep them glued to their devices and extract their data, and far too often exposes them to harmful content. Big tech's business model and deliberate design choices are undermining our children's well-being. And as we will hear in our next panel, their learning. So it is my pleasure to introduce Matt Miles and Joe Clement. Combined, they have over 40 years of experience as public schools teachers and coaches. They wrote the incredible book, Screen School, and will share with us the problems they have observed from screen overuse among students. They will also talk about the scientific research about the effects of screen overuse, what is currently going on in our schools, the direction educational technologies firms would like our schools to go, and most importantly, what we can do about it. Welcome, Matt and Joe.
Thank you very much. And thank you especially to the Schmill Foundation for this amazing event and all the incredible presenters we've already heard. I should say at the outset that Matt and I, as Josh mentioned, are teachers. We've been teachers for a long time, and we love our job. So I have to say, I'm required to say that I'm not speaking on behalf of our employer, which is, it's really a sign of the times that we have to say something like that. Matt and I wrote this book because over the last several years, we saw in our students a really concerning trend of a lack of ability to focus, a lack of ability to solve problems, to think critically, to interact socially even. And we started looking into what was going on because it was very noticeable, and it was noticeable to every teacher that we talked to. We said, well, what is happening? So we didn't start out with screen overuse as being a focus. But the more we read, the more it became impossible to ignore the effect that screen overuse was having on our kids. So we ended up writing this book, and we're doing it. The more, and we didn't stop our research there. The book was published in 2017, but the more we find out, the more we watch our kids continue to develop and fall further and further into the ensnarement of their smartphones and their all devices of all kinds. We're still, we know this fight is very much still going on. So Matt's going to kind of talk to you about how we got here, But thanks again for having us.
Yeah, so one of the things we wrote the book about, we were really writing it in response to what we as educators were hearing more and more frequently. And it was really this movement within education to get screens and devices in kids' hands as much as possible. And here's an article Mark Zuckerberg wrote or was quoted in years before the pandemic. And this is the idea of let's replace teachers with laptops and gamified learning and get kids on screens for most of their day. And he's pretty much, predicting the school year of 2020, 2021. And we were hearing this more and more frequently, and we really were starting to question what we were hearing. This is an example of a training video. Our county made us watch. Now we're not making fun of the girl here, but she's clearly given a script. And this is the kind of stuff we were hearing that we really kind of started to question. So you just watch this.
I know. The sight of me on the device in class makes some of you nervous. But I'm not posting selfies to Instagram right now. I'm actually in a Google Hangout typing questions to a researcher in Botswana about water conservation. It's part of a project I'm working on. My friend Emma just found a blog from the Chesapeake Bay Foundation with some awesome info as well. See? Technology provides great opportunities for us. It's a part of our lives. My teacher is making sure I know how to use it.
So
I know.
Oh. So Joe, how many times have you caught a kid in class on their phone talking to researchers from Botswana?
0.
Yeah, we show this to our students and they think it's hilarious too. And one of my students said, if you see me on my phone, there's a 0% chance I'm doing something productive. If you see me on my laptop, it's about 50%. And I thought that was pretty interesting. So those are the kind of things that we were being told all the time. Like, look at how leverage technology. And what we know is that kids weren't, and they still aren't using technology very effectively. One of the things that we get blamed for is killing kids' love of learning. And again, there's such a disconnect between the people who are writing this stuff, the educational policymakers, the people like Mark Zuckerberg and Bill Gates who are trying to get more technological based education, and that of what we see in classrooms. Those of us who actually work with kids or talk to kids. Some of these times, Joe and I say this all the time, we hear something like that. Does that person know a teenager? Like we killed a teen's love of learning. Do teens love like anything, right? And some of the terms that get flipped around, and again, just to kind of put this in context, last year was EdTech's moment to shine. This was something that's been a movement that's been in place for a decade now. And they were promoting things like personalized learning or student-centered learning. Is the idea that students can learn at their own pace, at their own time, and they can work through modules on their own, and they will love learning now because they can work at their own pace, right? Teachers were to be off to the side, right? We're more mentors, and when a kid has a question, they come and see us. Flipped classrooms where kids are essentially on their screens, they're watching videos, they're learning through technology, and then they come to ask the teachers question. Again, we're talking about what we all had to do last year when we were learning virtually. This is stuff that's been in place for at least 10 years, and the idea was by 2025, this would be the model of all public schools.
Right. So we've seen this before. Before COVID, this was Summit School. Who does Summit?
Facebook.
Facebook, right. So this was Summit's idea of what school would be like and it went into financially disadvantaged areas, and Facebook did, and Rocket Ship is the other one, where they go in and take over and just essentially say, we're going to hire very few teachers and kids are going to go and all day be on their devices. And you'll see this is again back in 2018. So we just sit there for so long, spends 5 hours a day in Summit classes. You have to teach yourself, the kid is quoted as saying, all we do is sit there. Teachers facilitate every kid, whatever. Every kid is supposed to get 10 to 15 minutes of one-on-one mentoring each week in that model. And so you can imagine what that does to a kid. Kids don't, that's not the way a kid wants to use technology. The idea that, oh, kids love technology, so let's do it in school, profoundly misunderstands both technology and kids. So we're really missing the boat there. You see this quote over on the left a lot, or this idea that online collaboration improves learning and productivity and student engagement. Well, when the pandemic happened and school went virtual, there was this Washington Post article about what happened when we rolled out in our district the virtual instruction. I'm not going to read these quotes. You can bring the next quotes up. So these were the kinds of things that were right away
within the first 20 minutes.
Right, literally within the first 20 minutes of an online school day. These are the sorts of things, and again, I'll give you a minute, you can read. I don't want to, it's disgusting, but this is the sort of thing that happens. So, you've got these two ends of the spectrum. You've got this horrible stuff on one end, and then you've got, oh, I'm going to be talking to a water researcher in Botswana on the other end. So there's this obvious disconnect between, fantasy and reality. And you have to ask yourself, what end of the spectrum is more likely? And if anybody is being honest, you understand that this is more likely, and it's not the kids' fault. Kids are being kids, and they're messing around when they maybe shouldn't be. But the idea that, oh, if we just have more technology, they're going to be more engaged, profoundly misunderstands kids, as evidence that this is a misunderstanding that's hundreds of years old, as Matt will tell you.
Yeah, so I used to have to teach I got to teach World History 1 and the Renaissance part of it. And my kids were always fascinated in the Northern Renaissance by some of Bregel's work. And you can see here, they love the fact that the kids were dressed like little miniature adults. And that was kind of the idea at the time, that children have all the intellectual abilities of an adult. However, they're just empty vases that need to be filled. See the two girls here at the bottom left. This one can barely even stand, and she's wearing essentially the same outfit as the older women. And it's the idea that kids are the same, they just need more information, right? And that's the idea that drives a lot of this ed tech. Well, Zoom works for adults. Why don't we just give it to kids? People getting paid to go work virtually are doing just fine. How about we see if that works in high schools? It profoundly misunderstands the psychology and the development of children and teens, something that teachers know intimately. We always use this as an example. So let's say you want to teach something, a lesson, and you want to implement it. You want to bring in technology, leverage modern 21st century technologies. Let's say you're teaching a subject on like the double helix and DNA. So you may link kids to a YouTube video by somebody like James Watson, who discovered the double helix, talking about the process. And that's cool and that's neat. Maybe even have them work with an online model of the double helix, and they can kind of interact with it in a cool, neat way. But again, children are children and teens are teens, right? When you have them open up their laptop, or you have them bring out an iPad or some type of technology like a cell phone, you're also bringing in everybody they've ever met, family, friends, people they met once or twice, everybody's right there.
Researchers in Botswana.
Everybody's just sitting right there, a click away, all vying for their attention, right? You have an arcade filled with endless plays and limitless, lives and just all the video games you can ever play. You have movies and television shows streaming on demand without any commercials, and of course you have enough pornography to fill warehouses, right? You put this in the hands of a teen, right, who, as we were just talking about a minute ago, has an enhanced FOMA, right? They gravitate towards their peers, they distance themselves from their adults, so all of their friends are right there. They have no executive, or they have lacking executive function from underdeveloped prefrontal cortexes, so it's hard for them to delay gratification. And they have enough sex hormones pumping through their veins to kill a baby elephant, for God's sakes. And you give them this device, and you expect them to use it productively. I always say, like, imagine like when we were older, if you stapled a Playboy in the front of your math textbook. It would be a wonder if you ever got to your your problem sets, right? And yet we do that every day.
Right. So predictably, it was a disaster last year, not just in where we teach, but worldwide. And Fairfax County developed this great phrase. It's highlighted there. We know from studies experienced significant unfinished learning. That's an amazing phrase.
They should have said non-started, but anyway.
Right. Because last year, I can tell you, and my kids are, my own kids are 23, 19, and 7. So I saw them at a variety of levels, college, high school, and elementary school. And the elementary school kids in particular, this year when they started out, we've all seen that. But so, we're talking about in our county spending $188 million to, like it says there at the bottom, address learning loss. So if this was all going to be so great, you go back to the idea that the Brooklyn school tried and we're going to put kids on screens all day long. If this is all so great, why all the unfinished learning and why all the learning loss? Because it's a disaster. There's a profound misunderstanding, again, of kids and technology. And when you put them both together, you're not going to get the results that, we're often promised. But the train rolls on. This was a Jeb Bush op-ed. Time to embrace distance learning, not just because of coronavirus. That was sort of at the first end of the pandemic, but we know everybody has kind of doubled down. And so it's frustrating to see in schools, but where there's starting to be some pushback. Organizations like Fair Play, of course, are really starting to get some attention. And in our county, where there's one brave high school principal who's banned cell phones in school. And the school board where we are is now talking about doing that countywide. So people are starting to pay attention, but they're only going to pay attention, of course, if we make them pay attention. So there's a lot of action steps that we can take, and we could go on for a while about these. But the first one is like the Matt's student pointed out, there's pretty much a 0% chance kids going to use a cell phone productively. So, and parents are sadly the ones that push back. Parents push back, I would say, at least as hard as the kids do on banning cell phones, because they feel Matt and I call it the digital umbilical cord. They have to be connected to the kid all day long, and the kid has to be connected to the parent. But none of us had constant connection with our parents when we were at school. You were at school, you solved your own problems, and then you went home. So it's obviously doable to not have a kid on a cell phone all day. One of the most damaging things schools require is online homework and online textbooks. Demand, like I said, there the paper text when possible, and it is always possible. Schools will tell you that it's not, but it is. And homework in particular needs to be offline, because one of the problems, there's this big war about homework, and we don't take necessarily a position about homework in general, but people will tell you, oh, my kid's got 5 hours of homework every night. And they don't. They've got 20 minutes of homework, and it takes them 5 hours, because if you were, I know if I had this kind of entertainment available to me when I was 15, there's no chance I would have gotten any homework done, right? Parents go in and they see their kid with their laptop open and they go, oh, poor baby's working so hard. Well, the kid heard mom or dad coming down the hall, alt-tabbed away from the video game and the Netflix and over to the, whatever the textbook is. And then mom or dad closed the door and they went back to whatever they're doing. It just takes too long because their focus is all over the place. A great idea that we heard from a parent in Texas was to demand a low tech or no tech track through school. If an elementary school has 3 first grades, start demanding 1 first grade classroom to be a low or no tech track that parents could opt their kid into. That is a very reasonable demand. A school system that would say no to that really has a different agenda than the well-being of kids. The ed tech virtues that you hear about, personalized learning, student-centered education, 21st century skills. 21st century skills are the same as they were in the 17th century for the most part. Being able to solve problems, communicate effectively, think critically, et cetera. Like you have to lead people and so on. Those are the real 21st century skills. And it's even in, like, if you look at Forbes magazine or whatever the business magazines are, they publish these lists of what do we need kids to do. It's all that stuff. And then of course, like I just said, the real 21st century skills are those. I'm also, I think we all have to be very careful about the language we use. My daughter was asking me something as I was putting this together, and I forget exactly what the context was, but she said, "Oh, the PowerPoint, it knows that blah blah blah," and I said, "Yeah," and then I went, well, "No, it doesn't know anything. It does what I tell it to do, and PowerPoint has the ability to let me do things because the programmer who made it gave it the ability to whatever, but it doesn't know anything." And we all use those words that personify our devices. And I think that, especially for a little kid, I just noticed it kind of sneaking into her vocabulary, and that becomes part of your consciousness. So I think that's another big thing that we can all do. But again, can't thank you enough, and I'm very much looking forward to the Q&A.
Yeah, thank you.
Thank you, Matt and Joe, for that really incredible and enlightening presentation. And when you were talking about distractions and the pandemic, I was flashing back to very early, and my daughter was 11 when the lockdown started, and watching her during online school, having 7 chat windows open at the same time, and thinking, this is probably the end of her ever being focused on one thing. She's going to be in a state of constant distraction for the rest of her life, and what a loss that is.
Yeah.
So we have a number of great audience questions for all of our panelists. I'm going to start with one for Matt and Joe, which is, we often hear from EdTech enthusiasts about meeting kids where they are, and kids love video games and social media. So we're increasingly seeing EdTech programs that are very gamified, that are video games where kids buy virtual items, are communicating like it's social media. What are some of the effects of training kids for education using these video game and social media tools? And are we grooming them to be compulsive users of video games and social media when we do that in schools?
Yeah, I'll start. Yeah, so I mean, of course, that's all part of. You have to remember that the ed tech industry is part of the tech industry, and they have a very significant interest, a financial interest in getting kids acculturated to just constantly being, marinating their brains in all the digital world. But it's ironic. Matt showed that quote early on that schools kill off the love of learning, which again happens in adolescence quite naturally in terms of the love of school and so on. Well, if you're really talking about killing off a love of learning, gamify it, make it something that you don't learn just because it's great to learn. You learn because you get points or you get this or that. That's a really perverse effect of gamifying learning. And I think the research also shows, and Matt's probably more versed in it than I am, that it's not even effective.
Yeah, the Nancy Carlson Page does a lot with this, and she's really great at explaining it. But the kids need, especially younger kids. I had to last year watch my kindergartner do math online through Dreambox, and he literally was sitting there crying one day because he couldn't figure out this problem. And I won't get into details, but they were trying to make him take blocks and make the number 6 out of it. And he was taking the 3 block and the 3 block and trying to put them together. It was saying wrong, wrong, wrong. And he was getting frustrated. He's like, that's 6. And I finally went over, I'm like, what the hell's going on? And I finally realized they want him to take 5 and 1. That was 6. And people talk about he was so frustrated, and he was right. And the game didn't recognize it, 1, and because they hadn't thought through everything, and it's poorly programmed. And 2, the research says that a child his age should be touching things, right? Learning's more tactile for a kid that young. And second of all, it's not even effective. Now it thinks my kid doesn't know 6. So it's constantly feeding him back 6 because you're like, oh, this idiot can't figure it out, right? So again, and I think the question, they're right. The evidence is that it does more to develop a love of gaming than it does to actually learning stuff. So yeah, I'm really anti gamified learning.
So Joe and Matt, a related question we have is, what are schools doing to address the social media overuse?
Have them use more social media?
Yeah. Yeah. one of the things Matt and I both teach is U.S. government. So we have a federal system. So that's great in a lot of ways. Obviously, one of the big challenges, of course, that we have is that it's different. I mean, when we talk about what are schools doing, I mean, I think it was I read at one point 80,000 school districts or something like that in America. Whatever it is, it's tens of thousands of different approaches. And again, there's a continuum. Some have held firm, and some have dipped their toe into social media and device usage and seen what happens, and they've pulled back. There's a school system in New Jersey that I'm thinking of. I can't remember which one that really realized it was a disaster and pulled away. And then there's others like ours that encourage every club to use a Twitter and an Instagram account. The school system uses Twitter and Instagram, and again, the thinking, this profound misunderstanding of kids and technology, that because kids like social media, that we should be doing social media. Well, kids like ice cream. So, I mean, you just say, well, forget about a regular dinner. You're just gonna have ice cream for every meal. I mean, because kids like something doesn't make it a good reason to do it. The adults have to be the adults and set the limits and set the expectations.
And I'll just add to that. I had a girl a few years ago who was diagnosed with severe depression and anxiety disorders, and her therapist actually convinced her to get off social media because she was spending 8-9 hours a day on social media. And she did, and she felt great. And she said she had never felt better. And when this was over the summer, when the school year started, she felt like she had to get back on social media because all the teachers are posting things, the clubs are posting things, like Joe was saying, the school is actually responding. She felt like she didn't get any information. She didn't know what was going on unless she was on social media. So schools have to be better about like requiring kids to be a part of, for school. One of the issues we have is by putting more things online and giving kids laptops, is they're making it really hard for parents who are trying to lessen their kids' screen time. Kid gets home and says, oh, I got to go do homework on my laptop, and every time you poke in, they're working, but then they're actually gaming and in chat rooms and other things. And schools are making the problem worse. They're making it really hard on parents. And that's why we say that as a parent, you should be able to push back and say you don't want your kids' homework online.
So I really appreciate that so much of the focus of today has been on this, not just as a parenting issue, but as a cultural and a societal and a regulatory issue. But we do have a lot of questions, not surprisingly, from parents about what they can be doing in their own home. I have a two-part question, which I think maybe Dr. Sussman might be best for you. One is about what are things that we can be doing with younger children in terms of social media and developing good habits, and with younger children we may have more control as parents, and what are some of the things that we can be doing with younger children. And then for older children who are already developing signs of compulsive use of screens, what are some of the things we can do with them? And there was specifically a question about, are there summer programs for kids who are suffering from screen addiction?
Okay, well, so I'll start out with the younger kids. I mean, someone said something about modeling in the intro to this. It is really important that parents realize that, little kids are monkey see, monkey do. They will do as you do, not as you say. And, young 5-year-olds, 6-year-olds, like they see their parents on a cell phone all the time or on a device all the time. That's what they're going to be doing, and that's what they're going to want to be doing. And it is important. I agree that the younger your kids are, the more important it is for parents to step in and set the limits. And then you can gradually wean off and give kids more autonomy as they enter their teen years. But you have to have developmentally appropriate parenting and decisions regarding technology. A good example of like some problems I've seen with parents of younger kids is like, for example, parents with babies, screen feeding, using a screen to distract them so that they'll eat and finish their meal. Like those are things that, as a parent, that really, that would really concern me. And so it's important, I think. It's sort of a cliche, but it's really true that you need to establish good habits early on, and there's really no reason for like all these like baby apps they have like on Fisher Price and everything where they literally have infants like online all the time. And I think like Baby Shark was like one of the most popular videos of all time. They make a lot of content now for really young kids. And so parents have to be aware of that, and they have to know that, it's not just teenagers who have an underdeveloped prefrontal cortex, it's babies too, and young kids too. And, you really have to limit and set limits. Now, on the alternative side is that, I think there's skills kids can learn. I'm not somebody who says kids just can't have any screen time at all. I think that there's important skills that kids need to learn, and you can actually sort of make lemons into lemonade by teaching them these skills with technology. One of those skills is delayed gratification, as we talked about. And another skill is just stopping when it's time to stop without a meltdown, right? Like handing back the device and moving on. And I think that if parents are setting clear and consistent limits to the amount of time that their kids can have a device for, maybe with a younger kid, it's like 15 minutes or half an hour, but it's the same every time. And it's followed by a much lower dopamine activity for at least that amount of time, if not longer. And it's in a day that has a lot of structured activity that are off screens. It may be a good opportunity to say, okay, it's time to turn in your screen. And, to reward the kid for doing it when they're supposed to have very logical consequences if they spend too long on it. Like maybe if they go 5 minutes over and won't turn it in, instead of having a power struggle, you take 3 times that, like 15 minutes off of their next block. So I come up with lots of strategies for kids to allow very reasonably, very small, limited blocks of the screen time to give their kids a healthy balance and to teach them to practice delaying their gratification and early, and stopping when they need to stop. And if you don't give them any screen time at all, they're not working on those skills as much. So, I think that with older kids, since you asked about that too, they're really, those are kids who are going to need to be able to self-regulate by the time they go to college. And so many of the patients I get are kids who either had parents who were too controlling and didn't give them any screens throughout high school, or always battled with them over it, or parents who were just too enabling and just let them binge on screens all the time. And then they go off to college and they have no ability to self-regulate and no ability to have a balance, and everything is at their disposal in college. There's no stopping them. And so many of these kids drop out, not the 4th year, but the 1st year of college. And then they come to see me. So just to answer the last part of the question about summer programs, one that I can mention off the top of my head for teenagers, I think you have to be over 14, is Restart, run by a colleague of mine, Hillary Cash, a great psychologist in Washington State. So they have a program that really focuses on screen addiction, and the summer program, I believe, is very good there as well. And there are summer camps popping up all over the country that claim to deal with screen addiction. It may just be that they're very structured and don't have any off-screen activities, which is good in and of itself, because that'll give your kids a dopamine detox, which, as you heard from Matt, that alone could help you a lot, just getting you off of that device for a while, kind of resetting the brain. And they have wilderness programs that are designed to do that. But just a word of caution to parents that detoxing is not enough. Because I talked about cues as well. And if you take the kid who's fully detoxed and you put him back in the same environment he was before, all those behaviors are going to come back. So it's really important to have a phase 2. If the only thing the summer program does is detox the kids, have a phase 2 in mind, where you're going to have things very balanced and that the parents are going to be setting clear limits. And it'll be easier to set those limits after the detox. And then phase 3 is the self-regulation. That's the ultimate goal.
Thank you, Dr. Sussman. And I think it's so important that you're telling us what we can do at home. And then we have a question about what we can do to support legislation for Dr. Austin. And I think maybe Josh will want to jump in also. Are there actions we can take to help move the critical legislation that you described forward?
Certainly, and I'm thrilled that somebody's thinking about this. I'm sure Josh is also. On the federal level, I know Fair Play is very engaged with Senator Blumenthal and Senator Blackburn around building community support for those bills. And then, of course, Fair Play is very involved in California also around, I think, both of those pieces of legislation. For those of you in the audience who might live in California, constituents are going to be so important for generating support among the lawmakers there. And Josh will be able to jump in here and say how to do that in California. Federally, anywhere you live in the U.S., you could be valuable in terms of telling your lawmaker you want to see COSA move forward. I think afterwards, probably maybe Deb Schmill for the Schmill Foundation will be able to follow up with everyone who's registered in the audience with some specific action steps. How do you get in touch with the advocacy around this? That'd help to get some details for who to get in touch with in Washington. Josh?
I don't have a lot to add. You really covered it there, but yes, I would say contacting your senators and asking them to co-sponsor the Kids Online Safety Act, or COSA, as well as updates to the Children's Online Privacy and Protection Act. I think one of the things that is just absolutely ridiculous about the regulatory environment we have for all of the media that our children are engaging in is that the only law that we have that protects them online was passed in 1998. So before we even had social media or YouTube or smartphones or iPads. And the other thing about that law is that it only goes up to age to a child's 13th birthday. So if you think about it, I have not been able to come up with one other legal context where we say on your 13th birthday, we are going to 100% treat you as an adult. So it's absolutely critical, especially given what Dr. Freed and Sussman and Austin shared about what this is doing to the mental health of teenagers, that we have protections for teens as well. I want to ask the next question of Dr. Freed. You started off talking about how there's so much information out there, and a lot of it is coming from people who are sponsored by industry or for industry front groups. Given that we live in an information age where there's just so much information coming at us all the time, how can parents sift through all of this? How can they know, who's sponsored by industry and who isn't, and how can they find that truly independent information to help guide their decisions with their children?
Josh, you just asked, I thought this was supposed to be a softball question. That is a really hard question. Firstly, I just want to say, I'm going to be testifying for AB 2408 on Tuesday. Contact your state representative in California if you are there, and give a shout out to the importance of that bill. Before Dr. Austin started speaking, she said, I don't take money from anybody. I would look anytime anyone is Fair Play. I can't think of a better place to start than Fair Play. This has to be the gold standard, or any standard moving forward, because Facebook and Meta are spending so much money to buy up experts, to buy off media. So much of the words you're going to see, maybe a small disclosure at the very bottom. It's so tough in this current environment. I think we've really got to start at places like Fair Play, and Fair Play is going to, look at Fair Play online if you're a parent, and then they're going to direct you to the people that they've vetted and said they trust and are not really putting their hands in the pockets of industry, because it's really hard. It's really hard to. There are so many people with big fancy initials behind their name. There are so many people with that end up in the New York Times and various other places who are knee deep in industry money, and they really don't disclose that. So we've really got to go to fair play, I think, is a good place to start.
Thanks, Richard. This question goes back to Joe and Matt, and perhaps others will want to chime in. I know that you mentioned, asking for hard copy books, asking for paper for our kids, but this is really more of a systemic question in the same vein. Celine Linku asks, I'm devastated to see that our public school system provides now screens to kids as young as kindergarten. My second grader is clearly distracted on the iPad he has in school and can access any games on Google from it. How does it affect their learning experience? How can public school tech departments block or limit usage to only learning tools? And is school learning on screens really unavoidable nowadays?
Well, I would say that's an interesting way to phrase it. Is school learning on screens unavoidable? I mean, I'm not sure. I don't want to be flip and say that there's no learning that takes place on a screen, but obviously people learn plenty of things. But is education going this route where it's going to be an integral part of the school day? I mean, I think we're definitely, Matt and I always talk about how far the pendulum is swinging, and perhaps we're reaching the apex of that swing, and maybe it's going to come back in the correct direction. I don't know that. I don't know. I don't know. Matt, do you want to chime in? Because I'm collecting myself here.
It's difficult to say. I always kind of liken last year to like the old school parent who caught their kid smoking a cigarette, so they made him smoke a whole pack. That is our use of technology last year. But before the pandemic, there's a lot of teachers who are gung-ho about educational technology. And since we've gotten back, when you talk about different software suites we can implement and games, and most teachers kind of just get like this repulse. Like last year was terrible. And I think most people are kind of over it as far as educators within. Now, the issue is really, it comes from the top. People who aren't in classrooms, who make educational policy, are the ones who tend to promote it. And I think if we can start encouraging superintendents and school boards to stop with this nonsense, I think that's how you make gains.
And it becomes, sorry to jump right back in there, but if we also listen to kids on this, kids are over it too. They hate online textbooks. They hate them. They don't like the fact that if you tell kids, get out your laptops and whatever, they groan, and when they do, and all you see is the back of the laptop, and the ones who are laughing and looking like they're really engaged are not doing whatever the assignment is. So they know themselves that they get distracted, and as soon as you open that thing, they're going to something that they're not supposed to be on. So the kids will lead the way on this as well as teachers. I think if anybody is going to pay attention, they've got to hear it from both sources.
So I have another question for Dr. Austin. We often hear about moral panics and, everybody freaked out about comic books in the 50s and the radio and Victorian novels. And in fact, a lot of the research that we have about social media is correlational and doesn't show causation. And some research shows smaller effects than others. How do you sift through all this research, and what do you make? What's your take on some of the results which appear to be somewhat contradictory?
Yeah, great question. And certainly the industry is doing their best to get confusion, to stoke confusion. And this is a strategy that's tried and true by many industries to sow doubt. This strategy has been used around environmental pollutants, global warming, around tobacco, to just keep getting people confused, telling them the data is only not causal, the data is correlational, that it's contradictory. But when you spend time with the data, we actually see a much clearer message. And that's something that my research group is doing now, is sifting through that data. A few points I want to flag. Especially when we're thinking about the mental health harms with teens, the work we're doing around eating disorders, we're not talking about just social media generally. That's something that, and we're way past that. We need to be talking about what specific aspects of how certain kinds of social media work, what the business practices are that are producing certain kinds of harmful outcomes. And so in our work, we're fast moving toward in the area of eating disorders and some of the mental health harms. It's the image-based media, that's social media, that's especially harmful. So that's one piece we're looking at there. We do have data that can parse out cause and effect, what's happening first temporally, what's following that. It's not just data that's correlational, as people like to say. We're in the process of putting some of the summary of what the data are showing forward. There's a number of experimental studies that have shown what is it about certain kinds of media engagement that elicit the negative mental health response or the body image challenges. And then we have, outside of what university-based researchers are doing, we have the watchdog groups, whether it's Fair Play, Tech Transparency Project, or journalists like Wall Street Journal, that are zeroing in on the business practices around the algorithms. No two people and no two children are going to be seeing the same feed. And that's where certainly there's some children where they're not having that much of a negative response around mental health. They're probably not using the same media. They're not coming with the same vulnerabilities, or they're not being targeted online in the same way. This is where we need to be able to parse out the specific exposures and link that to the business practices. With that, we have a really clear information about what's harmful. I gave some examples in my talk of feeds for some kids will be filled with self-harm, filled with suicidal ideation, filled with dangerous weight loss kinds of so-called advice. Not every teen is going to be seeing that kind of content, but for the ones who do, it can be dangerous and downright deadly. And that's where we need to focus with the legislation, which is that some of the bills that we mentioned do this. They're getting at what can we do through third-party risk auditing of algorithms so that we can suss out where are they going wrong, what are they doing to put kids at risk, and to change those business practices.
Thanks, Dr. Austin.
Ian, can I say one quick thing there?
Please, Jeff.
Just because Matt and I get a variation of that question a lot, and the difference between, like, because people will say, well, television, they talked about how bad television was going to be, and the difference, of course, with a smartphone is the two things. The television stays in one spot. The smartphone goes with you everywhere, and like when we were all growing up, a television show came on at a certain time, it was over at a certain time, and then you went on with your life. It's not the endless scroll on TikTok or whatever else. So there's a very big difference between social media and the way it's presented on a smartphone. When you have the intersection of those two things and then try and compare that to television, it's really not a great comparison. The other thing about correlation and causation, we read this paper by Melissa Hunt at University of Pennsylvania. It was about social media use, and she had kids, her students, or a control group there, lower their use and compare their mental health outcomes after a certain amount of time, and the kids who used less social media improved the way they felt, blah, 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 like you might expect. We asked her the question, what if you went the other direction and took the experimental group and said, use more social media? And she said it would be unethical. She allowed us to use her quote. You couldn't do that. Like, if you thought this was going to cause harm to somebody, if that was the hypothesis, you wouldn't be allowed to do it. So, I mean, just because you don't have exact causation doesn't mean that it's something that is harmless. And I think people have to be careful about that distinction.
Yeah, thanks, Joe. I think we've had some really fantastic questions today, and we have maybe time for one more question. We'll direct it to Dr. Sussman, and then maybe Joe or Matt will want to jump in. What is the impact of personal computers in schools on computer addiction? My experience now with college-age boys is that the required use of iPads and similar devices in middle school created distractions that the schools did not consistently control. The kids did not seem developmentally able to handle the gaming distractions, both in the classroom and at home while doing homework. How do we how do we balance the educational benefits with internet addiction inherent in distraction?
if you ask that question to the parents of most of the families I work with about, you know, how bringing a computer into school has impacted them and their addiction, it's a disaster. I mean, it's a disaster for teachers trying to like sort out who's actually on their computer and who isn't. You know, I mean, I think that devices alone, just having cell phones in a classroom is harmful enough. Just, you know, I mean, and schools do have the option of, you know, you can lock a cell phone in a locker. You can, you know, before the class, you can, the teachers can have these lockup bags. They're like little safe, like little bag-like safes that you can have the kids put their devices in when they come into class. So there are solutions to this. They're just not being used enough. Yeah, I mean, it's an incredible distraction to the person with the computer, to the people around them. You know, and again, it's a cue. We talked about cues before. When you have a device on your desk in a classroom, that's the same device that you're going home and gaming on. It sends that gaming cue to your brain that I'm going to get some dopamine cue. So even if you're not doing a highly dopaminergic activity on it, you're still getting that cue and your brain wants it. And so, you know, that's a real problem. And classrooms used to be a place where you could go to be free from technology, where the cues were all tech-free, low dopamine cues. You know, you have the teacher in front and the peers around you all at their desk studying. And so I think that's a real problem that needs to be dealt with. And I think that if you were to poll, I think a lot of parents that I work with, it's no surprise that they would all say that, you know, both distance learning at home during the pandemic, bringing screens into, you know, digitizing all the learning now, putting all the homework online. They say it's all a disaster, right? But and I think one of you might have been alluding to this, but what might surprise you is that a lot of the kids I work with who are the most addicted to screens actually have enough insight that when I ask them, they'll say, yeah, like during the pandemic, they were constantly complaining. You know, the kids who were the most screen addicted, they were constantly complaining that they couldn't go to class and see their friends and be off their screens. They knew it was harming them. You know, especially the older teenagers, and they didn't want distance learning, and they don't want screens. They don't want to have to use their computers in their class. A lot of them are actually aware it's a problem.
I don't want to cut you off, Dr. Sussman, but I think we are just about at time, and I know that Deb has a couple of closing remarks. So thank you all to the panelists.
Thank you.
I'll get started. A huge thank you to our presenters, Matt, Joe, Bryn, Clifford, and Richard, our moderators, Jean and Josh, our ASL interpreters, Rachel and Ellen, our co-host, Representative Garlick, and to the Needham Channel for recording and broadcasting this event, and to Karen Price and Mark Wayshak for doing an awesome job behind the scenes, making sure everything went smoothly. Just a few quick things before everyone leaves. At the end of this webinar, attendees will see a pop-up survey, and we would be extremely grateful if you would take a minute to fill that out. Also, concrete steps that we can all take will be posted on the website, our website, BeccaSchmillFoundation.org, and emailed to attendees. Please feel free to share these. The more we get this out, the better. I think we can all agree that every child deserves to grow up unscarred by their youth. And we appreciate anything you can do to help make that a reality. Thank you all for joining us today, and have a great rest of the day.